Hi, Carol.
Hi.
Hi. So here's your remedy. Why don't we just start with that?
Thank you.
And don't let the video
Do
distract
I
you.
hold it under my tongue?
Yeah, you just hold it under your tongue. Just want to make sure this is going. Yeah, it's going. Yeah, under the tongue, and make sure you don't eat or drink for 10, 20 minutes.
Oh, I won't. I probably won't be out of here in that time.
Yeah, it's good.
It's empty.
So let's start with your symptoms. So you said your throat feels
It's sore all the time.
continuously.
Continuously. And I have a dry cough. And
And how often is that? Is that throughout the day too?
throughout the day and night.
Really?
Yeah.
How long have you had the throat thing and the dry cough? You're talking weeks,
I'm
months?
talking months. It started with my throwing up. And it got sore, and then it got more sore. And I went to Mossaferin, and I said, I'm throwing up, and I don't know why, all the time. And then he asked me, are you doing it on purpose?
Yeah.
In a nice way, he asked it.
Yeah.
And I said, no, I'm not. I'm trying not to. I mean, sometimes it's just water, or
Are you
eat
still
a
throwing
grape.
up? Are you still
I
throwing
would
up?
throw up if I'm not on that acid reflux. I
You would
tried
throw
going off. I was off 2 days, and I spent 1 day throwing up.
So what's the name of that medication? Omeprazole. So you have to take omeprazole in order to prevent the throwing up.
Yeah, that's what I'm using it for. I also take probiotics,
Yeah.
and that's not helping me not throw up, but it makes me feel better. I think it helps with my digestion.
Okay.
It makes my tummy,
Sure.
I have a happy tummy then.
Right, right. So you've been vomiting for how long?
4 years.
For 4 years?
Yeah, maybe a little longer. It wasn't every day, but it got to the point it was every day. And maybe twice a day, sometimes 3 times a day.
And then when you started the omeprazole, the acid blocker, it stopped?
It stopped
Completely.
completely.
So you had it for that long?
I had it for years and years and years, throwing up, and I kept trying different things like digestive enzymes and stuff, but over the counter.
Yeah. So when did you start the omeprazole?
Oh, I don't remember. Let's see, probably
Roughly.
about 5 months ago.
And it's
No, not that long. Last spring. I think it was like February
of this year?
of this year. Yeah. Because I came in there to see him because I was throwing up.
Okay.
And he said he has had acid reflux problem with some throwing up.
Yeah.
And so he's on the same stuff, the Dr. Mossafarian.
Oh. Okay.
Oh, should I not say the name?
It's okay. I will delete that from the here.
Yeah.
Here, I'll just say 2 minutes and 50 seconds.
The other
Yeah, we
doctor.
shouldn't say
I'll call
his
him
name.
the other doctor.
Just tell him your medical doctor.
Medical doctor. Yeah, MD.
Yeah.
The MD.
Yeah, yeah. Okay, so you said that you haven't thrown up since February, right?
No, I have thrown up, but not if I remember to take the medicine. I was off of it because we were traveling and went down south to see my sister, and I forgot it.
Yeah,
And I didn't know you could get it over the counter.
right.
And I asked, after 2 days of being off of it, on the second day of being off of it, I was sick.
Okay. And then you feel a lump, the sensation of a lump?
When I swallow, it's hard to swallow like rice and swallow stuff. I have to
How
drink
does
a
it-
lot of water.
How does it feel?
It feels like my thyroid's swollen and pushes in on my throat.
Does it feel
And I
like...
have a lump here. You can see this here.
Yeah.
Yeah, and over here there's another lump. And it fills with blood in there.
What does the endocrinologist say about those lumps?
They're filling with blood, and they're precancerous.
That's what he says?
Yes.
You have a lump on both sides?
Yeah.
One on each side?
One smaller than the other. And I saw the MD,
Yeah?
let's see, this is last month,
Yeah?
about 4 weeks ago. It said there was no change in size, so that's good.
They're filled with blood, he said.
Yeah, he said he hadn't seen that before.
And they're precancerous.
They're precancerous, but they're not cancerous. He did a blood test and it said they weren't cancerous. He did biopsy. He did 6 of needles in there, 6 needles, biopsy needles, and None of them had cancer, nothing.
Okay. And then you
But
said
blood.
blood. What about hair loss? How long has that been a problem?
That's been a problem for a couple of years.
And even though you take levothyroxine for your thyroid, you
It
still
hasn't.
continue?
No, that is one of the side effects of that medicine is that you lose your hair when you first take it. So now I'm thinner than I was.
So you've been taking the levothyroxine for how long?
Since February.
Just this year?
Yeah. I think it's just this year. I think it was like February when I was in
And
there.
you still continue to lose hair?
I'm losing, right through here a little bit. But it's starting to come back. It just now started growing. You can see little short ones here. Short ones, maybe it's fuzzy, I don't know. I put oil on it so it wouldn't be.
What was that dizziness about? How long have you had that?
That has been going on for about 3 months, maybe 2 months, something like that.
You never had any dizziness prior to that?
No,
You said it's a side effect to something. What did
it's a side effect of the thyroid medicine.
You read that?
Yeah, it's in there, and also the MD told me that he noticed I had tremors in my hands, and he said that was caused by the thyroid medicine, and he would cut it back a little bit.
The tremors.
Mm-hmm.
And has he cut it back? Has he cut
Yeah,
it back?
he cut it back, and it's
helped.
better. Once in a while, I still get them,
Okay.
but I'm not sure that I always take my medicine right, because I have to take it at 2 in the morning or earlier, sometime in the middle of the night, because I like to take and I throw up in the morning, and I don't want to throw up even, I never know if I'm going to. I don't want to, ever. I don't like throwing up, so I use, I'm trying to keep it away from everything, the thyroid medicine. And when I had, I went on estrogen for a while, and I was throwing up really bad.
Yeah.
You said that it went with the thyroid medicine and that estrogen didn't work together. So I stopped the estrogen, and I didn't throw up as many times. It was affecting it.
Well,
you were right.
The estrogen overwhelms the liver. Hormones overwhelm the liver, female hormones.
So I don't want to be on it.
And I believe your throwing up comes from poor digestion, obviously. So
I think so, too.
Taking female hormones was just stressing your liver, I think.
Mm-hmm.
So, any other health concerns besides?
My arthritis, inflammation.
Okay.
I would say inflammation.
Okay, arthritis is affecting which joints?
The finger joints and the toe joints. And
All of them? All fingers and toes?
Yeah.
They're just hurting? Or all the
They're hurting and they're distorting,
deformed?
deformed looking.
Yeah.
Yeah.
So, and your toes
the toe
are
too. I'll show you.
Are your toes deformed too?
One is almost as big as my. Today it's not as sore, so I don't know. This one, see it?
Yeah.
It's huge,
Yeah, I see it.
and it's bent, and it
Yeah, I get
hurts.
it. Okay. So,
I want it to stop hurting.
sure. So, okay, do you have pain though? Because, I mean, not just deformity. Do you have pain in all the fingers? And
Oh
toes?
yeah, I have pain in them.
All of them, all toes and fingers.
Yeah,
What about other joints in your body?
the back. I have arthritis in my neck. That hurts a lot, and it makes me stiff. And the back has it in 2 places.
And so as far as which joints are deformed, the second digit in your
Yeah.
toe, and I saw it.
That's it.
I saw it. And then you have the deformity in the second digit in your hand.
First digit. And
that's
second a little bit.
that's considered second.
Oh, that's second. Yeah, we have to count the thumb.
Yeah. So your thumb and big toe would be first. So,
yeah, so it's that one. Oh, wow, you made a connection there.
Yeah, the second digit, and they're both on the left side.
Yeah.
Yeah. Second, left, finger, and toe.
Yep. And my back has it in 2 spots, which I wasn't aware of. And my neck has it. I was aware of that.
Okay. So back and neck.
Yeah.
Now, when you say arthritis in your back and neck, you were diagnosed with arthritis in
Yes.
those areas?
It showed up in the X-ray when after my skiing accident.
Okay.
Yeah, it showed up. My back was kind of like crooked.
Okay.
And my neck was really crooked.
Okay.
And the chiropractor said he only treats the back but not the neck.
Okay.
So he treated the back, and he said I had a perfect spine. He got it lined up, did an x-ray, said your spine's perfect right now. And right after that, it sounded like a .22 gun was shooting off. My neck made a popping noise and a grinding noise, and my neck went back in. It's just amazing. Because he balanced the spine, the neck actually corrected itself.
Beautiful.
I was amazed.
Beautiful.
I didn't expect it, but it happened.
Wonderful.
Yeah.
So, any other health concerns? Your skin. You want to talk about your skin?
Yeah, I have dry patches, and they get sore, and make my hands look really old.
Are they all over your body, or just mostly on your hands?
Mostly on my hands. I've got a little bit starting, and I have a lot of brown spots starting. These spots have started up.
Okay. So they're dry and what, flaky?
Flaky, and then they get sore underneath.
They're raised too.
Yeah, and they're raised up, and there's inflammation under them. And I have one spot of it on my face now. It's over here somewhere.
And they feel sore to touch or just sore?
Sore to touch, yeah. Yeah, that's real sore.
Okay.
And then I have a mole, not a mole, a wart.
Okay.
Right there and there, starting up.
Okay.
It's like my whole body's yelling and screaming at me.
Yeah.
And then I have ridges in my nails and splitting.
Oh, yeah.
Yeah,
Nailed it.
ridges and splitting in the nails. And I have too much body weight I'm carrying, and I think that stresses my thyroid too.
Mm-hmm, mm-hmm.
So I want to correct that.
Yeah, get rid of some of that.
I need to correct it.
Sounds good. So,
So I'm going to look 20 years younger and thinner, right? And will it be more than a week?
Yeah, hopefully. Hopefully it'll be less than a week. We'll work on it.
Okay.
That's good.
It's a challenge.
Yeah, I bet it is. So you know what? The body does heal nicely. You just have to give it what it needs and be patient and steady.
I need off of the drugs.
Yeah.
Yeah. My libido, too, is way down. But since I got on the thyroid medicine and stuff,
fine.
I think there's a connection.
Oh, definitely. Yeah.
I'm probably positive of that one.
Yeah.
Yeah. And
So-
I don't want to be...
Yeah.
I'm still young. I'm only
right.
66.
That's right.
Well, I'm 67 this year, but we're not counting that yet.
That's right. Well, any other health concerns?
Let me think.
Mm-hmm.
Anything you notice?
Well, you talk about symptoms that bother
That's
you.
about it, I think.
Okay. And you've had complete hysterectomy?
Yes. Had to give up some organs. I didn't want to. That's why I'm hanging on to my thyroid. I don't want to give anything up.
Right.
God put them there for a reason.
Mm-hmm.
They're mine. I don't want to go to heaven one piece at a time.
Yes.
I want to go all at once, you know?
That's good. So,
Do you have any questions for me?
yeah, I do. I have more questions. Let me see. Do you have any headaches? Let me just ask you a list of questions now, like straight down the list. It's probably yes, no type questions.
Okay.
Do you get headaches at all?
Not often, no. Maybe if I don't have coffee. That's addiction problem.
Okay. What about chest pain?
No.
Breathing difficulties?
Not really, no.
Okay. Any menopausal symptoms like hot flashes and night sweats?
Only the other night, and I usually don't have them. And the other night I was really warm, but my husband had lit a fire before we went to bed.
Yeah.
So I think the house was just too warm. I like to sleep cold.
Yeah. Your body temperature is usually warm, isn't it?
Yeah, very warm.
Very warm, yeah.
Yeah. And my voice has changed a bit with this, I think.
With what?
This throat being sore and stuff, I notice I sound more husky or coarser sounding, rougher, you know.
Yeah.
It doesn't sound a different voice than I used to have.
Mm-hmm. Yeah, I can imagine how that would affect your voice.
Yeah.
Okay, so
And I'm mucusy.
Yeah.
I've got a lot of mucus lately.
Okay.
And I don't like that. That's a sign too.
How lately?